This is a interesting patient. She has a brain tumor, but incidentally, we found that she's got this aneurysm, which is a irregular wide neck aneurysm, paraophthalmic. This is the origin of the ophthalmic artery. As you can see in the early injection, you see kind of a double layer of contrast. So this is the sac of the aneurysm. This is in fact a second small aneurysm as well. So the decision was to treat this aneurysm, at least a large one, because of the risk of rupture. It's about 7.5 millimeters in size. So we decided to treat this before the patient goes to surgery. We were gonna probably leave this alone. The problem is the wide neck, so we thought it's better to prepare the patient with antiplatelets just in case that we need to put a stent. So I started by placing the microcatheter inside the sac of the aneurysm. This is the tip of the microcatheter over here. This is the microcatheter. This is a distal axis soft guiding catheter we can go in. I tried placing the coils initially, but it was really a very wide neck. I could not keep the coils inside the sac. So I decided to do stent assisted coiling technique. So this is a stent. Through the same guiding catheter, you can pass another small microcatheter across the artery and then place the stent. You see these markers, proximal and distal, across the neck of the aneurysm, and then place the coils within the sac with these small microcatheter, which was kind of jailed. We call it jailing technique, and then do the coiling, continue coiling until we were able to get a good, basically complete occlusion of the sac of the aneurysm with the coils. So this is what we call a stent-assisted coiling technique that we do it for aneurysm coiling. So this is the final picture. This is a stent. You can see it here, proximal distal. This is a tiny aneurysm that I did not do anything about for the time being. This is the sac which is occluded. This is part of the sac as well. It's not in the parent artery.